Hello and welcome to the most hated show in the black corner of YouTube. I am your host, the whiteologist, Mr. Blow Your Mind, and this is Black Minds News Report. Black Minds News is to report, articulate, transmit, communicate, insinuate, develop, investigate, decode, unveil, spread the news, whether it's by news, video, website, or quote from publications. As I articulate this information at the creator of the universe, be it heart, soul, mind, and spirit, because why? The truth don't need no partner. As a descendant of the greatest people who created this land that he called the United States, we, the today's children, present generation, and offsprings, we give honor to our ancestors. You know what the motto of my show is? I'm never going to tell you what I heard. I'm only going to tell you what I know. Today's date is April 10th, 2020. Have you heard? Have you heard? Well, been some news breaking, talking about some things according to those who are avid watchers of this show. Things I have laid out in two successive 3-hour videos. You know, that's not normal for me, but did it anyway. And so, based on some of the things that I have put out in those videos, news articles have come out talking about how there's a possibility legislatively and the implementation of what they're doing that may have some concerns. Again, this is not trying to say that there is fire in the theater, but at least you can't say you didn't hear it. So again, we as Black Minds News, we come to bring this information, and stay tuned as we get into this broadcast. Hey, how's y'all doing, everybody? Again, this is your host, Mr. Blow Your Minds, and welcome to Black Minds News Report. First and foremost, I want to get out the way. What's good to my fam? My subscribers, old and some new ones. Welcome again. We thank you kindly for subscribing. Welcome to the Black Minds News family, and hopefully that you are having time to take out your day to see what we're doing over here. If you should happen to be a passerby, we always got a grand opening over here. You can go down the aisle, see some things that you can like. If you happen to see something to make you feel some kind of way, remember my motto short is the truth don't need no partner. All right. So as I was saying here that, I've laid out in the last couple shows things that is pertaining to the fact that okay, hold on, you don't jump the gun there, sir. There you go, you ready to go, huh? Slow your roll. So again, as I said, I had done a couple shows back to back, and I was just trying to lay out some information that, again, we're now in the heat of a pandemic. Still looking for the flattening of the curve. We're hearing reports as Black Americans are being the catalyst, the poster, the name on the marquee as to being the holders of this virus. And so in my second video, I put out the question as to how did the Roni or the Rona find its way into the ghettos, right? Somebody broke through the firewalls and been infecting what would be in our computer system. And so now that they're constantly putting these pieces out here, I think it's incumbent that those who have shows, news shows, and who disseminate information, we must stay vigilant. We must stay on the watchtower, on the wall, to see how this game of chess is being played. Some people may not see the seriousness of where we are right now. We as BADOS, when you think about our history in this land, I think we've been through a lot of scenarios that we kind of built for this when you think about it, right? We done been through so much. Matter of fact, when you look at yourself and realize how much we've been through as Black Americans in this land, and see that you are of the descendant of those who endured many atrocities that had been laid. Because you know the old saying is, when white folks catch cold, black folks catch pneumonia, right? And so, based on the softening of our people as time, since we call ourselves progressing in this land, and not sticking to the old ways of how we reared, what we talked about, what is our agenda, and understanding that everybody that smiles, like that old song, Smiling Faces, or backstabbers, not everybody that smiles in your face and everybody patting you on your back may not have the best interest for you. So when you let your guard down and then finally realize that somebody got you in a compromising position, I hear a lot of people now trying to talk about the things that should be done, but this will be after the fact, right? Now that you have to deal with trying to survive and make it through, because it's just ironic. Sunday's coming, considered to be the Passover, and understanding that story and understanding how, talking about putting the lamb's blood on the door so that death passes your home. So it's kind of like everybody who's out here trying to make sure that they have all the necessities of prevention. Let's say a pound of prevention is a pound of cure. And so the timing of all of this, and people, and we as Black people, at least according to the way we used to be historically as spiritual people, and one thing that we as historically under the condition that we always have been under, seems like as much as most people may consider themselves to be religious and talk about religion and Christianity, but we as BADOS, Black American Descendants of Slave in this nation, God had to be real to us because of what we were enduring. And somewhere as what people believe that progress has happened and obtained certain education, started to get certain figures in their money, starting to, fraternize and socialize and chumming it up with other people, kind of let your guard down. Now you at a point where, because you kind of look at it like this way. Let me say it like this. We're going to get into the show. Just before all this took place, and this is no shot at any of them, actors, athletes, and so forth, but haven't it been kind of quiet amongst them? Have you noticed that they're not talking anything pertaining to other than the fact that stay home? You mean to tell me people who fraternize and rubbing elbows and got some kind of inside track information, no one has stepped out to say what they believe or think? So that's why you see that it looks like, as I played the Willie Lynch letter and talking about how the implementation of that indoctrination seems to have failed, that every individual who was considered to be a tool used for indoctrination kind of lost their spirit amongst the people. So got into a situation, it seems, that we're going to have to reset this and re-implement. And it looks like we might be the ones that they're going to start it with, this experiment, right? So I'm going to start off when I seen this here, right? I seen this story here. And it's really going on to the fact that, remember when, again, I did the video. And you go ahead and set that up. There you go. All right. And in that video, I laid out some things that I had been, just gaining as I was getting all those articles and reports. And I kind of painted a picture for those who've seen that video. And one video that I did display, and again, I talked about Chicago, because Chicago would be a hub where BADOS is. Like, when you talk about the great migration in this country from the 40s, and they use that as called as the diaspora. Two parts is only considered when you look up the diaspora, but they added something new later on. The diaspora was considered those that were considered in Israel, and those who were considered in the South, in the United States, migrating from the South, going into, what you want to say, the North, or going into the other cities, right? Then later on, they use that as anybody who migrated from another place coming to another land. But originally, it was just the reference, again, Israel, and we are those BADOS in this land. That does not, I'm not here to exclude or single out. I'm just saying what it is. And so as I talked about, when they label Black Americans, are we to take that solely as only BADOS, or is that a motley group of immigrants, people from other, geographical locations, and Black Americans? Because when they start, again, as I said, they start using the terms hypertension, right? Diabetes. Is that term specified only for Black Americans and immigrants? Or is that only specified for Black Americans? Because Black Americans, is the term itself, is only for those who have come out of the South. Okay? And supposedly that those who migrate from other places don't use the term. Maybe if it's, again, using something to be beneficial, they might. So when I made the second video as into how do we get the corona in our neighborhoods, and I laid out some of the things that they had, then today they came out with this here. And to come out now and say this, after you've seen the video I already displayed that before this came out, then I will talk about it when we come back. So we ready to do this? All right, so let's go ahead and let's do this, and then we'll be right back. Check this out, y'all, and we shall be right back. Check this out. Judge rejects release of vulnerable Cook County Jail inmates. Orders coronavirus testing. I'm going to say that again. Judge rejects release of vulnerable Cook County Jail inmates. Orders coronavirus testing. This story is coming out of CBS News, April the 10th, 2020. And this how it reads. Federal judge on Thursday denied requests to release medically vulnerable inmates at Chicago Cook County Jail, but ordered officials to step up coronavirus testing for detainees and improve sanitation protocols. The facility is experiencing one of the largest outbreaks from a single location in the country. Last week, attorneys for two detainees with pre-existing medical conditions filed a lawsuit in the United States District Court for the Northern District of Illinois. The suit names Cook County Sheriff Tom Dart as a defendant and demands improved conditions inside the facility, as well as the release or transfer of all medically vulnerable inmates. In a 37-page opinion, Judge Matthew Kinley found the plaintiffs did not go through all their legal options at the state level for the release of the inmates. Kinley, however, ordered Dart to promptly test all inmates who display symptoms of the virus or have been exposed to someone who has tested positive. To reduce the risk of the spread, the judge also ordered Dart to enforce social distancing for new inmates and suspend the use of bullpens, an area where inmates are in close confinement. The sheriff's office said in a statement Thursday that much of what the court is requiring today has been well underway for weeks and even months in some cases. More than 400 confirmed cases of the virus have been linked to the jail. As of Thursday, 276 detainees and 172 sheriff's office staff have tested positive. One detainee died after contracting the virus. Sanitation in the jail is not a new problem, said Alexa Van Brunt, director of the MacArthur Justice Center Clinic at Northwestern University. One of the groups who filed the suit is clear from anyone who spent time in there that the measures that currently exist are not going to be enough to protect people. Certainly not enough to comply with CDC guidelines. The sheriff's office statement called the lawsuit headline-seeking, adding that it an unnecessary and costly distraction in the middle of such a crisis for our frontline officers and medical staff, whose around-the-clock work is saving lives. In response to the pandemic, an expedited bond review was implemented in Cook County last month. The process has put more than 1,500 cases before judges, according to the Cook County State's Attorney Office. The Sheriff's Office said that there's been a 22% decrease in its population since March 9th. With close to 4,500 inmates currently, the facility is at an all-time low. CBS News recently spoke to 3 staffers and 2 former inmates of the conditions of anonymity out of fear of retaliation. They claimed tensions ran high after officials announced the first confirmed case inside the facility and criticized the jail's initial response to the outbreak. Last month, a 500-bed quarantine facility was built to house sick inmates. The sheriff's office has denied claims of inadequate cleaning and sanitation protocols in the past. In a statement on Thursday, the office said, "We appreciate that the judge acknowledged the many unique and aggressive efforts that the office has undertaken to identify and help those who catch the virus and to limit its spread." Sheriff Dart has until Monday, April 13th at 4 p.m. local time to present a report about how his office intends to comply with the order. A status hearing has been scheduled for next Tuesday via phone. "This is a result of all the people on the ground coming forward," added Van Brunt. "This is just a first step, and we realize people are still at high risk inside the jails for illness and death. We're evaluating our next steps about what to do about that."
Well, a federal judge is denying requests for a mass release of inmates from Cook County Jail in Chicago. More than 400 coronavirus cases have been confirmed at the facility, and the judge denied the request, saying that the inmates did not meet the criteria to pursue all their legal options for release at the state level. However, the judge did order Cook County Sheriff to test inmates if they show symptoms or have been exposed to someone who tested positive, and enforce social distancing measures. The rule came just just a day before the death of a second inmate at the facility. The family of the first is already suing the jail and sheriff for allegedly shackling him during his treatment.
Boy, it's hard to find good help these days, huh? So we back, right? So we see that the judge rejects release of vulnerable Cook County jail inmates, orders coronavirus testing. But I did a video again about 2 days ago that a video had came out. And the reason why I was doing about Chicago is because Chicago had been highlighted, but those 72% of those who are contracting the coronavirus, and there's 60% of the people who were of the numbers of the 140 that I did on the research through the health board, department board data. And so that video talked about how they were trying to get releasing of hundreds of inmates of those who had, lesser crimes, not murder, just kind of like child support and what other things it could be, right? And so we seen that there was a press conference where they were talking about that they released at that time, because they talked about there was 5,600 total inmates in Cook County, and then they said they want to release about 2,000. And we see that April 10th, a story comes out that a judge is now rejecting the releasing of vulnerable Cook County jail inmates. So that means that, there must have been a halt into the process. But is that just now being said? Because let's say through the country, state to state, a lot of the correctional facilities were releasing inmates back into their communities. Now, I'm not against, because a lot of times, like I say, if these are just menial crimes, petty crimes, and they're not a danger back into the community from that aspect, then why not? But because of the severity and the numbers that they keep displaying, to see what this judge is saying now, I think that should have been already done prior to releasing originally. That they should have been ordering coronavirus testing before you released them originally. The thing is, again, if you've seen the two videos that I did prior, remember when I showed you that there was a proclamation declaration by Donald Trump that was for March 13th, but they kind of grandfathered back to March 1st because they had the information about the outbreak, as I showed in that video, the second one, yesterday's video. I gave you all the articles that laid out what had been written going all the way back to January. So they had knowledge. The CDC knew, State Department knew, and according to the numbers that they talk about, they dispersed amongst the country, they knew. So even I also showed an article where they said that would the correctional facilities be able to handle when this come? So the preparation should have been already in place because they knew it was coming. So to do it at the last minute, one has to question that the good deed that maybe some see as releasing. But if you're talking about that a lot of the inmates now are coming up positive and have symptoms, then if you release them back into the communities, let's just take this here as Cook County and Chicago, then you can see why the numbers have skyrocketed. I'm not saying that every inmate that was released was, tested positive. But again, breaching your firewall, as I try to say, well, how could the Rona get into the communities? Other than the fact that, as I stated, many of the black people who got jobs, as I say, grunt work, healthcare, servers, right? Sanitation, all that good stuff, government employees, mail carriers, front line, as they say. And majority of the people that were still going to work, the job was deemed essential. And then they did not do a differential pay. Now, again, for those who know about that, when you work a different shift, it's supposed to be the different pay if you work third shift. But when it's in a pandemic, jobs is not offering, but knowing that you could not refuse, not because you wanted to, because you could afford to do it, is because you could not afford not to work. So that left a lot of our people vulnerable, accessible, because your contact with other people who might have been carriers, now you're breaching the walls and bringing them inside. Again, black people's communities are already segregated and put and located so they'd be away from people. Except for those, again, you move to other neighborhoods amongst other people. We're talking about the congregated black Americans that live in the so-called low ends and black communities. So when I showed the reports and who were the people that was deemed that was carrier, I would not assume that these would be people who would be in the low ends. So you had to say, how did the low ends get it? Is because they were coming in contact when everybody seemed to not know what was going on, because if it was already, again, I showed you where they had the reports talking about as far back as November, but they're going to deny the fact that no one's going to admit that, but they're going to say December 1st, and then they're talking about December 31st, and then they say the first cases here reported end up originally would be like the 23rd or the 26th, but even has some articles that has some of the first ones, because the one that's on the 26th of January is like the 4th or the 5th, that's in Orange County. But then there's 4 people prior to them. So again, talking about patient 0. And so that this judge is now taking the measures to make sure that if you're going to release any of the inmates, first make sure they've been tested so that we're not releasing them back in. But it seems like somebody originally, when they were doing it, that was not even a thought in their mind. They was going with the conjecture of mind that they was doing something good and not understanding. I won't say they didn't. I'm going to say maybe that was part of the chess move. Because it seems that your statistics and data is pointing directly only to black people. Now, I'm using Chicago as the catalyst because I believe Chicago might be the catalyst for when they try to implement as I go on to more into this show. So we see that what ended up happening here is that some individuals who were detainees decided that they believe that they should be under the pre-existing conditions that they had, that they wanted to file to try to get up out of there. And so once they went through the process, it seems that You know, Judge Matthew Kennelly found that the plaintiffs did not go through all their legal options. So they want to exhaust all the options before, you know what I'm saying, make them go through the rigmarole when this is a life and death situation. Now, again, they do not state whether the ones who are requesting for release, what were their backgrounds. And so by them going through, and then we're talking about this day and age, is April 10th, we're talking about months into this. So a lot of this should have been taken care of a lot more. Again, the general population had no knowledge. We just start to know into the late March. By this time, it's way too late, right? Think about it, it's way too late. And so, you know, some people will say that, you know, it should have had nothing to do with race. But again, as we being BADOS in this land, I believe it's always about race. So they talked about more than 400 confirmed cases of the virus had been linked to the jail. That was 400, right? They said 276 detainees and 172 sheriffs. Now those sheriffs are going to and fro, back and forth, right? They're going in places, they're going home, they, you know, to and fro. So, but there's these 276 detainees. Yeah, okay, were they part of those release of the 2000? And so we can see why Chicago may have had the high numbers due to the simple fact that there may have been the release, knowing that those who were already going to be released were already carriers. And so going in amongst people not knowing, now they can, you know, contract it. Now again, some people will say this might be all blown out of proportion. But let's just say we got to take it because the way they got us right now. So we got to take it with some kind of seriousness, because it could just be what it is, or it can just be chess moves. But again, we're going to still have to move and play the game with caution. So that's what I want to start with, that the inmates and then being released into the communities. And what bearing would that have on the effects as time go on? Because remember, they had put the report in I did in the other show, where the Surgeon General, Jason Jerome, right? And they said that the numbers about 3,000 deaths a day. Well, the thing should have came one mind is, how can you forecast something like that? What did you know that everybody else didn't know? And if that be the forecast, then you are expecting a lot more. And so let's just say, with that being said, let me show you something that also came out today. Okay? And I'm going to play, after you see this part here, I'm going to read to you a little bit of, like, there's a part in there that I got to read to you, because it gives you a little bit more background, because this story here has a front, but it's not the front part that I'm looking at. It's the underneath, the underlining. So let me show what I'm talking about. You ready to crank that up? All right, crank that up, and let's go ahead and try to get it going, right? Get it. Being a person of color is a risk factor for coronavirus. Living in a racist country is. You know I'm going to say that again. Being a person of color is a risk factor for coronavirus. Living in a racist country is. This story is coming out of the Boston Globe, April the 10th, 2020, and this is how this reads. Racism is a killer. In a pandemic, it's a mass murderer. While staggering, the disproportionately high rates of infection and death in communities of color from coronavirus are not unexpected. Even in a global health crisis, Black and brown people can't practice social distancing from the systematic, institutional, and foundational racism that overshadows and undermines our lives. When you are subjected to racism and internalized racism, it can lead to poor health outcomes, said Dr. Fatima Kadi, Stanford, an obesity medicine physician at Massachusetts General Hospital and Harvard Medical School. We live in a very racist society, so it's not at all surprising that this is something we need to be aware of and think about as we talk about COVID-19. In states compiling coronavirus data by race and ethnicity, Black and brown people are dying at rates more than twice their share of the population. Massachusetts is also showing this dire trend after weeks of pressure from Representative Ayanna Pressley. Senator Elizabeth Warren and many other state officials finally released some race and ethnicity data on coronavirus cases and COVID-19 deaths. Even the limit numbers reveal what Boston City Councilor Julia Mejia already suspected. Black and brown communities are being ravaged by the virus. Black people comprise more than 40% of Boston coronavirus cases. Chelsea, a city of working-class Latinx immigrants, has the state highest incident rates of infections. I grew up in Boston, and I know what health inequities look like based on your zip code, she said. We are always the highest risk for everything. We always bear the brunt of all of these scenarios. To address this racial disparity, Mayor Martin J. Walsh has announced the formation of a new COVID-19 health inequity task force. From AIDS, which still disproportionately affects Black women, to Hurricane Katrina, which devastated New Orleans' predominantly Black neighborhoods, disasters explode into repercussive catastrophes for Black and brown people. To ignore the virus impact of communities of color is to deny the impact of racism itself. This is the result of decades of substandard housing, living in food deserts, which can lead to higher rates of diabetes, obesity, and heart disease, and more respiratory diseases due to poor environmental conditions. Being underemployed and underinsured has made many Latinx and Black people especially vulnerable in this unprecedented health crisis. Stress can also contribute significantly to high health risk factors, Stanford said. We know as Black folks that as we talk and live and breathe, we are subjected to much more intense stressors than other populations. Mia points out that stay-at-home advisories or orders mean little to people whose jobs don't allow them that luxury. Many don't have paid sick leave. Every time they leave the house, when they take mass transit to go to work, they put themselves and their families in harm's way. I call it the privilege gap, she said. If we really want to be honest about this conversation, it's about those who have and those who have not. And those who have not had not for a long time. COVID-19 sheds light on a reality a lot of us have already known. That's why it's not shocking that despite the advice of health experts, some Black men don't feel safe wearing masks in public. 2 Black men recently filed a complaint after a police officer last month followed them into a Walmart in Illinois and demanded they remove their surgical masks. In a video posted to Twitter by one of the young men, he said they were asked to leave the store. In Illinois, Black people make up 15% of the population, but comprise 42% of COVID-19's death. This pandemic has pulled back the curtain of the deep-rooted systematic racism that exists in America right now, Mejia says. People are talking about this because of this crisis. But I want to talk about this beyond COVID-19. There has to be a long-term strategy to dismantle systematic racism. New information about racial and ethnic disparity does not address testing or treatment, which may reveal still more inequities. Simply knowing the raw statistics about race and ethnicity in this pandemic does not go deep enough, Stanford said. Any data needs to be quantified in a way that's meaningful to achieve a cohesive and comprehensive statement about the many ways in which this virus is attacking marginalized communities and how we can close the gap. Coronavirus does not discriminate. It doesn't need to. In a nation strategically built on racial and economic inequalities, it was never going to be the great equalizer, some touted. Being a black or brown person is not a pre-existing condition. Yet this pandemic is a lethal reminder that living in a racist country is. All right, we are back. Okay. So that was the article was being a person of color isn't a risk factor for coronavirus. Living in a racist country is. Now, what I'm about to talk about here, when we talked about ADOS, BADOS, FB, FBA, B1, a lot of people felt like Black Americans are being divisive when we try to distinguish ourselves based on, one, we have a claim in this land based on what our ancestors have contributed and what we have been enduring the whole time. And what COVID-19, the coronavirus has displayed is the inequities, the inequalities, the disenfranchised of centuries, people like to say decades, centuries that we've been enduring. And so it looks like anything that has to deal with just solely talking about Black people, no one is ever going to talk about it. So what you see is they have to use terms like persons of color, right? To encompass somebody else. Solely being Black, that means everybody who is not in this group don't, as Michael Jackson said, they really don't care about us, right? So this article came out on the 10th, and it's trying to show that, I don't know, it seems like I'm freezing over here, but I don't understand why there's so much freezing going on, right? I understand where all this freezing coming from. But anyway, it's talking about how racism is a killer. Now, who would know more about racism being a killer? Now, again, this isn't about tit for tat, whose plight is worse. It's like saying the Jews want to monopolize and say that the Holocaust is the greatest atrocity that ever happened in history, but we as Black people might be able to have a card in our deck that we might be able to trump that. That doesn't negate the fact that that took place, but we're going to say when it comes to racism, Black Americans know it well. And so they say that in the pandemic, it's a mass murderer, a serial killer more like it in this case is going from state to state, right? And so everybody will talk about how, the disproportionate high rates of the infections and how in the communities really are Black people, but they're going to say of color because now you're encompassing other people. That would be like having a box of crayons, 126 box, do they have that? 64 box of crayon, And in that box of crayons got all colors and there's just one white crayon. Let me say that again. Those who remember getting the 64 box of crayons, when you use the term person of color, you're talking about every color in the box except for the white crayon. I, as a BADOS in this land, is not trying to say that every color in that box has gone through what my people have gone through. So, in this case, what this crisis is pertaining more to, as the stats and what they keep reporting, I'm not saying that people are not dying, people are not contracting. But I think the advocacy here, when we talk about the conditions, where was Brown at in the history when Black was building, slaving on the plantations and working sun up, but they can't see in the morning to can't see at night? What part of the history do you partake in that? So, the problem is nobody wants to address directly the issues dealing with Black Americans. And so as the person who writes this is talking about how encompassing themselves and saying, well, you know, subjected to racism, the internalizing racism, the poor health conditions that, you know, is contributed to this internalized racism that created the outcomes that what you're seeing today, and that this person is credible because this person is coming from the Harvard Medical School, right? So it's a doctor, so that gives that person credence or validity because they're the one that's speaking this, right? And so we see that they started to compile these coronavirus data, started to bring out the race and ethnicity, is because they started to talk about it. Because again, what people don't want to say when they ask the question, when they say, well, Black people were not taking it serious, is due to the simple fact, not because they didn't take it serious, it was because articles had came out when it was talking about, seemed like other people were crying, well, why is Africa not getting it? Why Africa not getting it? And so that became where people started to say, well, Africans ain't get it. And what is the common, line, or what is the common line between us and Africans is we Africans too. So if whatever's in them is in us. And so obviously if they not getting it, then we not getting it. Then somehow all of a sudden the Tasmanian devil came in and just ravaged in everywhere. And then somehow we became posted, the numbers that elevated, we always in that. And it's like, whoa, wait a minute. So some people might even be thinking that because we said that, and maybe the numbers are conflated. I ain't gonna say are they conflated, but they may not be showing the real culprit of who's really the real holders of it. And so when they talk about fragility of mind and people like that, do you think, let's say, if we could ever get the truth of what the numbers are, and it would be somebody else that is not Black, because as this was beginning to manifest itself in this country, the Asian community, because, coming from the top, which would be from the president on down to the rest of the nation, calling it the Chinese virus, people became offended. Don't call it that, because you're labeling us. Well, it's kind of funny. The thing is about being in this country as a BADOS. Every other people, because they always like to use this, well, everybody here is an immigrant. We, as Black Americans, are not immigrants. Everybody else had a choice in coming. We had no choice. Some will even say we were already here. Now, it depends on what side of the coin or the side of the books that you want to read on that. I will go with both. But I'm just saying, if you here as an immigrant and you can wave a flag calling a certain day that you giving regards to back home from where you came, how is your plight like mine? Because I got no flag. You get what I'm saying? Now, again, everybody will say, well, you guys are from West Africa. But I ain't got no flag. The only flag I got is I got to wave the same flag that is here, right? That's my flag, right? But in this country, I can't get the benefits of the country because it seems like somehow, somewhere in the game got tricked, but America became an immigrant country of the immigrants, right? But the black people who done built the country, who, if you're going to say anybody indigenous, because the Indians, again, you made your deal, whatever that was, and again, that's not to take anything away from that, but that leaves the black people left, who didn't get nothing. You got land, casinos, some kind of, tax, okay, you got all that. What did black Americans? So anytime when somebody want to talk about the black issue, we got to encompass somebody else or use the term minorities. Deal strictly with black folks. Because again, just as I showed in the video, right? The video showed here was the mayor of Chicago who sat there, oh, look at the display and the disparities in the numbers, and this is not right. And then not even 24 hours later, you give money to people who are immigrants. Where was the money that should be directly going to black people who going through the destitute? That ain't even what we want to look at. So in order for them to get people to look at it, now you got to try to bring somebody else into the conversation to give weight, to give credence to it. Now, when you use the word Latinx, right? Where is Latin at? Europe? So that tells me somebody got to, kind of like being I don't want to say mulatto or mixed person. I'm just going to say, I'm going to say that. I'm going to say a person who's mixed. A person who is mixed is kind of like somebody today where they talk about, well, I was born a man, but I feel like I'm a woman. Or I'm a woman, born naturally a woman, but I feel like a man. Well, when you tell me Latinx, when you talk about another nation that you come from, and you can have the best of both worlds, the black American don't have the best of both worlds. This is the only world that it got. Now, there's a lot of people who are going to be upset because they say, well, you don't want to be African. I can be African all day long. Me going over to, matter of fact, did you see how many people they showing that are leaving Africa, getting up out of Africa because it's getting hot and coming back, but yet they was over there repatriating themselves, talking about the year of return, but now that it done got hot, motherfuckers flying their ass back over here, right? You understand? You African, but if they was, thinking they felt like the conditions was going to be good for them, they would have stayed. Do you imagine? It get real hot there. People already in somewhat of a destitute don't got. So guess who's going to be, who's on house everybody going to be looking at? Because we know you got some, because you are an American. You get what I'm saying? That's why they getting themselves up out of there. Because they knew it was only a matter of time. Everybody going to come over there where you at, and ain't nobody going to save you. And you supposed to be down and you on the team. Now, I know some people going to be back. Come on, man. You try to see that black on black. I'm not saying that. You understand? Let's say somebody take the DNA test. You come to find that somebody is related to you. Call you up on the phone, call you up on the telephone. And, hey, man, can we come hang out a little bit? You like, man, I don't really know you. But you can introduce one of your real cousin that's close to you. I'm not saying that this person is not related to you, but I'm just saying the closest to you, introduce you. You come to, well, this is such and such from DNA. And some people you ain't really never know, but you come to find you tied in blood. You may hold that to be, saying, okay, that's what it is. But I mean, the relationship, because you ain't never really been with them, if shit pop off, do you gonna jump in front of the bullet for them? Or you gotta be, man, you better come on run with me. You know what I'm saying? And then if something happened to you, it's not that you damn, something, you just like, damn, I ain't really know him like that. I ain't know, you know what I'm saying? I ain't even know him like that. So what you think, how it is that we go over to the continent, we claiming, we got blood ties, we don't have no last name, no family, no tribe. Again, everything would be a ritual trying to get you into something. And then all of a sudden now, that's what we're supposed to be. No. So this being our land that we've been, and then our ancestors and blood and died for, and it seems that somehow in all that, this land became an immigrant land. everybody can come here, and everybody talking about what they entitled to, but no one wants to really address that. We're knowing that these people here did all this, went through all this, but everybody want what they want, and then put them to the side. So the only way that you can get something, you got to bring some of them along, and so that it gives like some validity to it. Ain't that something? It's crazy when you really think about it. And so also that it talked about in this article was talking about how the black and brown communities are being ravaged by the virus. Next, most of the time when you look at these stats, it's black, then white, then it's Hispanic, then it's Asians, right? I'm not saying that they're not having, that the virus is not contracted. I'm not saying that people are not dying. But if we go across the board, the way that the news has been, reporting these numbers, you know what I'm saying? This was the NCAA, we be the number one seed. Now it will fluctuate who be 2, 3, and 4, and 5 in the top 5 and top 10, but number one seed gonna be us, right? And so it's like everybody again say, well, I don't even want to say that. I ain't gonna say that, but anyway, so it goes on in this article and it talks about now again, Hurricane Katrina. Was that brown people? Was that brown people? That was disproportionate? When they talk about AIDS, is that brown people or they said black women, right? When you talk about these catastrophes in the history in this country, I don't see other people, brown people, as being, again, the number one seed. It looks like black people are always the number one seed. And so if you don't want us to be the number one seed and then try to reap the benefits of being number one, then we have to say, then what's really the true motive of other people? Even though they know it done took place to us, but when it comes to you trying to get something, everybody don't want you to get nothing because then they say they can't get nothing in their bag, right? Anyway, I know this is not the real time to be saying this because, again, what is being purported as what we're dealing with, but the truth of the matter is, this isn't real issue, and race is a real issue and always have been in this land. And so it talks about to ignore the virus impacts on communities of color is denying the impact of racism itself. You don't need to say color. You just have to say on black people. See, when you start putting that in, it dilutes. To me, you're diluting the seriousness of it. If you keep it black, based on what we know in this country, it's so dark, it's so catastrophic that it's too much that nobody don't even want to talk about. That's how bad it is. So adding other people to it who can't really bridge themselves in that history like that, it dilutes it. And that's what it says. It's like your coffee, right? Say my coffee too black, put some milk in it, then I like it. But when it got some milk in it, it then took the black out of it, right? I don't want my coffee too black. See, that's how that is. Because if it's too black, it's too strong. And the truth of the matter is, we all know what that has been. So they talk about the results of, they say decades. I ain't gonna talk about no decades. We're gonna talk about centuries. See, when you start putting decades being 10 decades, how many 10 decades you talking about? We erase that decades and put in centuries. 4 centuries on that. How about 5 centuries on that? Then when you start saying centuries like that, what happens? It excludes everybody else that you're trying to attach. Where was you when we was going through that? Where was you at? Where was you at? Where was you at? Right? So nobody want to do that because then it solely leaves us just us and we're the only ones in line to be able to collect. And everybody else who seem to be somewhat selfish want to find a way how to get in. I mean, I seen something the other day where they were showing that how Hispanics are trying to take on the title of indigenous because there's something to gain in the indigenous title that gets you afforded something by claiming that. And some people say that this is what somebody doing in this, what's her name, Cortez, that's what she's trying to line up. So again, it's like people are trying to figure out strategic ways how to bump us. And another person want to bump us is because ain't trying to pay. You know what I'm saying? We know now that you want to put this out and talk about the conditions and the long, prolonged abuse and disproportionate and all this stuff. So guess what? The more that this ravage, the less we got to be paying out. You get what I'm saying? Now, again, is this a natural thing? Well, some people will say it's not a natural thing. Just depends on what side of the issue you're looking at it from. So it also talks about the stress and how it contributes significantly to the health risk. Yes, being black in this country is stressful. You got it to the point that sometimes there's black people who ain't even black any damn more, right? They as white as they can be from a mindset. You may look externally be they black, but internally in that mind, you know what I'm saying? You got people who will go against, right? As we're talking about, there's a lot of people who see what's going on, who are black people, but ain't finna say nothing because that ain't got nothing to do with you, right? Anyway, right? So, so stress, again, that could be anybody, but compound for being black in this country is even more, right? Again, there's a part in being Hispanic, Latinx, that you can ride on the fact, based on how you're not looking externally, you can, again, people are with this census, and there's another thing I'll be talking about in some videos coming about this census thing that been delayed, right? But that census was revealing that a lot of people were clicking on trying to get into the white game, trying to get that honorary white status, right? So it's only beneficial to be brown and minorities when it's somehow you can get a handout from uncle who's passing out some money, right? So this person here was talking about how, again, when they started to say stay at home, right? Well, black people didn't have the luxury to be staying at home. Why? Because why? There's that. So they didn't have the luxury to staying at home unless they had some paid sick leave, right? And even with that being said, majority of the jobs that were, again, as I talked about, work in the essential capacity. So they couldn't just do that, right? And so it just the environments that they come, and then the going into those so-called essential works, possibly getting exposed, bringing it home. But other people were able to leave and not have to come out and not have to worry economically about that. But because we've been here, and we ain't gonna talk about no decades, for centuries, and yet everybody want to act as if like, oh, we've been included in every aspect of it. Well, that's what it is. Creator is revealing the true. See, he's doing everything not to deal with and trying to get around it, but somehow Creator always gonna show that mirror to reflect who you truly is, right? So, talking about the great equalizer, there's no great equalizer, right? Everybody will say that the coronavirus doesn't discriminate. How do you know? How do you know? Based on the way that the stories are being told, and it seems disproportionately towards one versus everybody else. Oh, it's the underlying conditions, they say, right? That's what they say, right? They say all that is the underlying condition. Well, let me tell you something. Let me show you something here. Let me show you something here. I want you to hear this white woman here. This white woman here for to tell you something. If racism isn't a part of the game, then why would this woman, her name is Dr. Annie, I think it's Bukasek, right? Bukasek. That is her name. Why? Now, I want you to hear this white woman and listen to what she says and wondering how long she going to be around. Because she's really going against the system by what she's about to say that you about to hear. Right? Well, let me go ahead. Let me show you this. You got it all set up? You can do that afterwards. Okay, do that afterwards. Yeah, do that afterwards. Okay. You ready to get into that? All right, let's go ahead and do that and be right back. Check this out.
How the CDC and National Vital Statistics System are instructing physicians to fill out death certificates related to COVID-19. Brace yourselves and please pay attention and let what I'm about to tell you sink in. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not." End of quote. The CDC report of cases in the U.S. memo from yesterday states the death numbers are preliminary, quote, and have not been confirmed. So, quote, the results are preliminary and have not been confirmed, end of quote. It's from the CDC website. Here's a quote even more laden with meaning. Stephen Schwartz, National Director of the Division of Vital Statistics, says in answer to the question as stated in the organization's COVID-19 alert, quote, "Should COVID-19 be reported on the death certificate only with a confirmed test?" Check out his answer, and I quote from this memo of which I have a copy, quote, "COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc." End of quote. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. Fact, quote, "COVID-19 caused death," end of quote, and, quote, "assumed death by COVID-19," end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19. I'm almost done, but want to clarify the process with another patient example. This is something that could happen commonly. It's not a specific patient I'm thinking of. Let's say it's a sick patient who goes into respiratory arrest at home. He is intubated at home by EMTs. They put a tube down his throat to help him breathe. He's taken to the hospital by ambulance, put on a ventilator in the ICU, put on antibiotics for presumed sepsis, given IV fluids because his blood pressure has bottomed out. The bacteria pneumococcus is found in the blood and sputum cultures. Pneumonia is seen on the chest x-ray. Despite the staff's best efforts, he dies 2 days after admission. Like I said, this is not an uncommon scenario. The patient was found to be COVID-19 positive, and the doctor has the option of listing on the death certificate that COVID-19 is the immediate or antecedent cause because the doctor theorizes that COVID-19 contributed. Either way, it goes into the data bank as caused by COVID-19. To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list as one they list this case as one more COVID-19 death, and then go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us. I hope I was able to make my point. The real number of COVID-19 deaths are not what most people are told and what they then think. How many people have actually died from COVID-19 is anyone's guess. Again, God only knows. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. Thank you.
All right, so we back. We're going on some going there, freezing up everything, right? All right, so that was Dr. Annie Bukasek, right? And she put out a report that she said she got from a March 24th, 2020. I think it's called the NS or NVSS, right? Which is the National Vital Statistics System, right? And it looks like that Ms. Bukasek here is trying to explain or tell some truth as to, like, you know, Mr. Blower Mind been trying to say that and show the data and the numbers and how somebody says 72%, and then when you go back and look at the numbers, it's not 72%, and then you're trying to use 1,824 and trying to make that appear as that's the death, when that's really talking about the total number of people, again, in the 2.7 million population, and 30% of that population, 1,824 have contracted. But then the numbers was only about 140 deaths, and you say 50-something% of that is of black people. Not, again, I'm never going to downplay people dying. It's not what I'm saying. And I'm not saying that no virus don't exist. What I'm saying is the conflating. You're trying to posterize, right? And so she's showing that according to how the CDC was trying to have them, when they fill out, the doctors to fill out the death certificate, and a certain way they would categorize under the assumption of the doctor, not what supposedly specifically happened. Let me say that again. The doctor's assumption of what he believes. Right? It's kind of like the judicial system. Isn't the judge rendered his decision on his own interpretation, right? There's not no script that he got to follow per se. It's his interpretation and understanding and how he renders it. So that's the same thing you're doing here in this, situation. And so one doctor had said, well, can we categorize a death without even having testing? And they're like, yeah. Right? So, according to what this Annie Bukasek is showing here, that a lot of the deaths that they were reporting may not have been COVID-19 or coronavirus, or they did not die from it. They had underlying issues that they might have died from that. And again, there's a lot of people saying stay yourself up out of it because, again, you know, say going there for a broken toe and getting amputated leg. You get what I'm saying? And so accordingly, she said that there was a CDC reported the cases in the United States, right? This was a CDC, and accordingly, she still has all the documents. If anybody wanted copies of those, right? She said that the death numbers are preliminary, right? Preliminary, right? So just in case one, Mr. Blow, I'm not going to go ahead and go into show this preliminary, right? So when you say preliminary, this is what you're saying, right? So you're kind of saying that it is the, could be the steps or measures, right? It could be the building block, right? Clearing the deck, the readying, the tuning up, the briefing, the front matter, right? It could be the beginning, the opening, right? The forward, the prelude, the introduction. So if somebody has something that fits part of the criteria, you can then diagnose it entirely that. We got, as she gave an example of a person who had something in the underlying that they found in the mucus that there was pneumonia that was showed on the x-ray, you got COVID. Now, why would this white woman come out here and say these things? Why is she, doing like Paul Revere? They tell us in history, and they come to find out that Paul Revere really, I think, was a really black man. But anyway, British are coming. So here she is saying some things that she's going against the grain. Well, some of them comments in there, they were talking about, what her death certificate going to say. Her death certificate is going to say suicide, right? Somebody said that, right? But anyway, we're not wishing that upon her. But again, the revealing of that truth. So she said that also that it have not been confirmed, that she's saying these are preliminary and they have not been confirmed, talking about the cases in the United States. But yet on TV, 100,000, 200,000, 3,000 going to die tomorrow. Huh? Really? But no one was confirmed with any COVID tests. And so they got a criterion that everything that fit according to what they have given them. As she said, you do your best guesswork and you just say what it is when, again, for all we know, somebody could be getting back a kickback for every time that they wrote a death certificate saying that you died of COVID. So we're saying there's some diabolicalness happening, right? There's something that is not, let's say, it doesn't smell sweet in Denmark, right? And so they say also that, the difference in the disease cause, the soon-to cause, or somehow contributed to the death. So you got three categories that you can place and put them in this one category. There's three parts that if any of these three, you can throw them in there, right? And so can people psychosomatically have killed themselves based on the fear of thinking that, okay, they done told you tested positive, you have some symptoms, but again, it could be from other things. It could have been just the simple fact you had flu. Then you being in the hospital with the fear in your mind, and then they got you isolated. Could that contribute to do it? We again, as she say, the true cases of knowing that who really died of this will never be known. Matter of fact, let me see if I can show you this, because they were showing the mass graves. Did y'all see that? They were showing mass graves. Let me see if I can get. A second potential COVID-19 vaccine backed by Bill and Melinda Gates is entering human testing. You know I'm going to say that again. A second potential COVID-19 vaccine backed by Bill and Melinda Gates is entering human testing. This story was done by Darrell Etherington, coming out of TC. This is how it reads. A new COVID-19 vaccine candidate is entering phase 1 clinical human testing today, after the U.S. Food and Drug Administration accepted an application from Inovio Pharmaceuticals under the regulator's investigational new drug program. Inovio plans to inject its first volunteer test subject with the IKNOW 4800 DNA vaccine candidate it has developed. Following promising results from preclinical studies performed on animals that did indicate increased immune response, the Inovio DNA vaccine candidate works by injecting a specifically engineered plasmid, a small independent genetic structure, into a patient so that their cells can produce a desired targeted antibody to fight off a specific infection. DNA vaccines, while available and approved for a variety of animal infections in veterinary medicine, have not yet been approved for human use. That said, Inovio Works isn't starting from scratch. The company previously completed a phase 1 study for a DNA vaccine candidate for Middle East Respiratory Syndrome, which is MERS, where it showed promising results and a high level of antibodies produced in subjects that persist for an extended period of time. Inovio has been able to scale up quickly, developing and producing thousands of doses of IKNOW 4800 in just a few short weeks in order to support its phase 1 and phase 2 trials. The company has done so in parts thanks to backing from the Bill and Melinda Gates Foundation, as well as funding from other nonprofits and organizations. If clinical trials are successful, Inovio says it will be able to have up to 1 million doses of the vaccines ready by the end of the year, for use both in additional trials and for potential emergency use pending authorizations. This is the second vaccine to undertake phase 1 clinical testing on human subjects. Moderna began this trial in mid-March. Inovio trials will be made up of 40 volunteers, all healthy adults selected via screening conducted at either Philadelphia's Perelman School of Medicine and the University of Pennsylvania or the Center for Pharmaceutical Research in Kansas City. It spans the next several weeks, and the company expected data around the immune response from test subjects, as well as info pertaining to the safety of the treatment for humans, to be available by late this summer. Any broad clearance of approval for use is still likely at least a year to 18 months away, but for the pace with which human trials are beginning is still exceptional. So hopefully we won't have to wait too much longer than that.
There are pockets and significant pockets of the country where vaccines aren't happening because of those, the anti-vaxxers or whatever you want to call them, who have made significant headway and trying to convince parents they shouldn't vaccinate children. I was just looking at new data today from Orange County, California, with more than a few schools showing between 40 and 60% children not vaccinated.
You could say this is we're a victim of success. In the countries where you have measles all the time, nobody gets confused about this.
Do you get mad about it?
I get more mad about the deaths we're not avoiding. I spend my time on the countries where you still have, in the case of measles, over 300,000 kids dying a year. In the case of diarrheal diseases, over 1 million a year. There's 6 million kids a year still dying. Why aren't we getting vaccines out in Africa for diarrhea, for respiratory disease? Why don't we yet have a vaccine for malaria? Those are the things that I push forward. I wouldn't say I get angry, but I'm really impatient that we're not moving as fast as I'd like.
Falsy. Coronavirus immunity cards for Americans are being discussed. You know I'm going to say that again. Falsy. Coronavirus immunity cards for Americans are being discussed. This story is coming out of the Politico. It says the proposal already being implemented by German researchers is under consideration in the United Kingdom and Italy. This story was done April the 10th, 2020. And this is how it reads. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, revealed Friday the federal government is considering issuing American certificates of immunity from the coronavirus as the Trump administration worked to better identify those who have been infected and restarted the United States economy in the coming weeks. You know that's possible, Fauci told CNN Newsday when asked whether he could imagine a time when people across the country carry such forms of identification. I mean, it's one of those things that we talk about when we want to make sure that we know who the vulnerable people are and not, he said. This is something that's being discussed. I think it might actually have some merit under certain circumstances. The proposal is contingent upon the widespread deployment of antibody tests, which the National Institute of Health and the Food and Drug Administrations are in the process of validating in the United States, Fauci said. Within a period of a week or so, we're going to have a rather large number of tests that are available to the public, he added. The development of a comprehensive antibody testing system represents the next phase of the administration's effort to reopen the country and begin reintegrating essential workers such as healthcare providers and first responders back into society. Although coronavirus testing thus far has been able to determine if an individual has an active infection, antibody tests reports whether a symptomatic person was previously infected but has since recovered, potentially allowing them to return to their jobs. As we move or as we look forward, as we get to the point of at least considering opening up the country, as it were, it's very important to appreciate and to understand how much that virus has penetrated the society, Fauci said. Immunity certificates are already being implemented by researchers in Germany and have been floated by the United Kingdom and Italy, the most recent epicenter of the global outbreak in Europe. In parts of China, citizens are required to display color codes on their smartphones indicating their contagion risk. A controversial surveillance measure facilitated earlier this week the end of the lockdown of Wuhan, a city in China's central province of Hubei where the novel coronavirus first emerged. Asked Thursday about various methods of monitoring Americans who have come into contact with those who are infected, Dr. Robert Redfield, director of the Center of Disease Control and Prevention, said, "People are looking at all the different modern technologies that could be brought to bear to make contact tracing more efficient and effective. Are there more, if you will say, tech-savvy ways to be more comprehensive in contact tracing versus the old-fashioned way? Currently, these things are under aggression evaluation, Redfield told NPR. The 115-year-old Supreme Court opinion that could determine rights during a pandemic. I'm going to say that again. The 115-year-old Supreme Court opinion that could determine rights during a pandemic. This story is coming out of CNN Politics. Date April the 10th, 2020. And this is how it reads. When a U.S. appeals court ruled this week that Texas could prevent physicians from performing abortions because of the COVID-19 pandemic, the judges leaned heavily on a 1905 Supreme Court decision against a Massachusetts man who had refused vaccinations during a smallpox outbreak. That case could be invoked more in the months ahead. It is the High Court's touchstone for state power during public health crisis. But it is a decision with limits. The 1905 court warned against arbitrary or oppressive regulations and expressly connected mandatory vaccinations to ending the spread of smallpox. Today, the question is how bluntly the case known as Jacobson versus Massachusetts might be wielded to justify curbing individuals' liberties without caveat. In the first decision of its kind during the coronavirus crisis, the Fifth United States Circuit Court of Appeals relied wholly on the 1905 case to permit Texas to include abortion clinics in its ban on non-essential medical services and surgeries. The panel, ruling by a 2-1 vote, rejected arguments regarding the right to abortions ingrained by the Supreme Court, 1973 Roe v. Wade, and subsequent rulings. Jacobs instruct that all constitutional rights may be reasonably restricted to combat a public health emergency, wrote Judge Stuart Kyle Duncan for the majority. The Fifth Circuit has a record of decisions against abortion access, including in a Louisiana dispute over physicians' regulations, begun long before the current pandemic and now pending at the United States Supreme Court. Dissenting in the new case, Judge James Dennis argued that the majority had taken the Jacobson proceedings too far. Unlike in the earlier 1900s, Dennis wrote, when vaccinations would stop the smallpox outbreak, the thread connecting the Texas measure to combating COVID-19 is more attenuated. Premised not on the ideal that abortion providers are spreading the virus, but that their continued operations require the use of resources that should be conserved and made available to healthcare workers fighting the outbreak. Texas Republican Governor Greg Abbott's order was intended to save medical resources, including personal protective equipment, PPE. Other federal judges ruling in similar controversies over non-essential services and abortion access, including in Oklahoma, have rejected the broad interpretation of Jacobson's adopted by the Fifth Circuit majority. Abortion providers who challenge the Texas order are continuing to press their case in lower court, and the matter may soon end up before the 9 justices of the United States Supreme Court. The Fifth Circuit used Jacobson in a very wooden way and without appreciating everything that has happened. doctrinally and constitutionally in the 115 years since, said Northeastern University law professor Wendy Parmit, who specializes in public health law. They cherry-picked from Jacobson. Professor Dorit Rice, an expert on vaccination and public health issues at University of California, Hastings Law School, said the 1905 case has until now been largely under the radar, relied on mostly for local outbreaks such as the New York City order for a measles vaccination last year, declaring a limited public health emergency. Mayor Bill de Blasio ordered focus on children in Orthodox Jewish communities in areas of Brooklyn that had experienced spike in measles infections. Supreme Court ruling over the past century have established greater substantiated protections for individual liberties, including reproductive rights, Reese said. It is clear that Jacobson is still relevant, she said, but there's no good grounds for ignoring the other jurisprudence that we have had since. The Supreme Court decided the case Jacobson versus Massachusetts during the early 20th century when the court was generally favoring economic rights over individual liberties. The same year it struck down a law limiting worker hours and declared freedom of contract. The early 20th century also experienced widespread threats of smallpox and other infectious diseases, leading to vaccination mandate. Henning Jacobson, a minister, refused to be vaccinated by the Cambridge Board of Health, saying he had had bad reactions to previous vaccinations. He was fined $5 under Massachusetts law. Jacobson argued that the penalty violated his personal liberties to care for his own health. In its 7-2 ruling, the Supreme Court acknowledged individual liberties, rights, but emphasized the state police powers to handle a health emergency. The justice highlighted concern for the common good and compared vaccinations that can halt an outbreak with quarantines of ships arriving American ports with cases of yellow fever abroad. Whatever may be thought of the expediencies of this statute, it cannot be affirmed to be beyond question. In implacable conflict with the Constitution, the opinion stated, nor in view of the methods employed to stamp out the disease of smallpox. Can anyone confidently assert that the means prescribed by the state to that end has no real or substantial relation to the protection of the public health and public safety? That means, says Columbia University constitutional law professor Gillian Metzger, that government measures today must be grounded in public health needs and tailored to address the specific problems. Metzger and other legal experts say Jacob's son has not played a major role in other COVID-19 disputes, but it could influence cases as the pandemic deepens and other controversies emerge. Metzger speculated that shelter-in-place rules would greatly pass constitutional muster, but blanket travel restrictions, for example, keeping all New Yorkers from crossing state borders, would not, she said, in 1905 opinion, should be interpreted in combination with subsequent high court decisions on individual rights. Jacobson stand for the proposition that government can take significant measures for public health. Metzger said, but it doesn't give a free pass to regulation. There has to be a real or substantial relation between problems and solutions. In its arguments of the Fifth Circuit in the abortion case, Texas argued that the Supreme Court cases involving the rights to abortion are superseded by state interests in public health. In the dire emergency we now face, a state police powers and interests stand at their apex, and nothing in the Constitution protects an absolute right to an elective abortion on demand in the circumstance presented here, the Texas Attorney General wrote, leaning on Jacobson. When it's ruled, the Fifth Circuit went farther in its use of the 1905 case, referring to it dozens of times as the court rejected arguments from state abortion providers. It asserted that 3 of the Supreme Court principal abortion cases cited Jacobson with approval and without suggesting that abortion rights are somehow exempt from its framework. But in those three instances, the fact that Jacobson's citations are mere and offer to suggestions that Jacob would dictate the breadth of the reproductive rights. The sentencing judge, Dennis, did not reject the salience of Jacobson in these times. Rather, he pointed out its limits, referring to the United States judge earlier ruling against Texas in the dispute. Dennis said the district court result was supported by nearly 50 years of Supreme Court proceedings protecting a woman's right to choose. Concluded Dennis, in a time where panic and fear already consume our daily lives, the majority opinions inflict further panic and fear on women in Texas by depriving them, without justification, of their constitutional rights, exposing them to the risk of continuing an unwanted pregnancy, as well as the risk of traveling to other states in search of time-sensitive medical care. All right, this is coming from the link inside the article that is talking about the Legal Information Institute that is putting out Hennings-Jacobson versus the Commonwealth of Massachusetts. And it's talking about 197 U.S. 11. And it's talking about it was argued on December the 6th of 1904, decided on February 20th, 1905. Harlan's opinion. This case involves the validity under the Constitution of the United States of certain provisions in the statutes Massachusetts relating to vaccinations. The revised law of that Commonwealth, Chapter 75, 137, provides that the Board of Health of a city or town, if, in its opinion, it is necessary for the public health or safety, shall require and enforce the vaccination and revaccination of all the inhabitants thereof, and shall provide them with the means of free vaccination, whoever being over 21 years of age and not under guardianship, refuses or neglects to comply with such requirements, shall forfeit $5. An exemption is made in favor of children who present a certificate signed by a registered physician that they are unfit subjects for vaccination. 139. Proceeding under the above statutes, the Board of Health of the City of Cambridge, Massachusetts, on the 27th day of February 1902, adopt the following regulations. Whereas smallpox has been prevalent to some extent in the city of Cambridge and still continues to increase. And whereas it is necessary for the speedy extermination of the disease that all persons not protected by vaccination should be vaccinated. And whereas in the opinion of the board, the public health and safety requires the vaccination or revaccination of all the inhabitants of Cambridge, be it ordered that all the inhabitants of the city who have not been successfully vaccinated since March 1st of 1897 be vaccinated or revaccinated. Subsequently, the board adopted an additional regulation empowering a named physician to enforce the vaccination of persons as directed by the board as its special meeting of February 27th. The above regulation being enforced, the plaintiff in error, Jacobson, was proceeded against by a criminal complaint in one of the inferior courts of Massachusetts. The complaint charged that on the 17th day of July of 1902, the Board of Health of Cambridge, being of the opinion that it was necessary for the public health and safety, required the vaccination and revaccination of all the inhabitants thereof who had not been successfully vaccinated since the first day of March 1897, and provided them with the means of free vaccination, and that the defendant, being over 21 years of age and not under guardianship, refused and neglected to comply with such requirements. The defendant, having been arraigned, pleaded not guilty. The government put in evidence the above regulations adopted by the Board of Health and made proof tending to show that its chairman informed the defendant that by refusing to be vaccinated, he would incur the penalty provided by the statute and would be prosecuted therefore, that he offered to vaccinate the defendant without expense to him, and that the offer was declined, and the defendant refused to be vaccinated. The prosecution having introduced no other evidence, the defendant made numerous offers of proof, but the trial court ruled that each and all of the facts offered to be proved by the defendant were immaterial and excluded all proof of them. The defendant, standing upon his offer of proof and introducing no evidence, asked numerous instructions to the jury, among which were the following: that Section 137 of Chapter 75 of the Revised Laws of Massachusetts was in derogation of the rights secured to the defendant by the preamble of the Constitution of the United States, tended to subvert and defeat the purposes of the Constitution as declared in its preamble. That the section referred to was derogation of the rights secured to the defendant by the 14th Amendment of the Constitution of the United States, and especially of the clauses of that amendment, providing that no state shall make or enforce any law abridging the privileges or immunities of citizens of the United States, nor deprive any person of life, liberty, or property without due process of law, nor deny to any persons within the jurisdictions the equal protection of the laws, and that said section was opposed to the spirit of the Constitution. Each of the defendant's prayer for instructions was rejected, and he duly accepted. The defendant requested the court, but the court refused to instruct the jury to return a verdict of not guilty. And the court instructed the jury in substance that if they believed the evidence introduced by the Commonwealth and were satisfied beyond a reasonable doubt that the defendant was guilty of the offense charged in the complaint, they would be warranted in finding a verdict of guilty. A verdict of guilty was thereupon returned. The case was then continued for the opinion of the Supreme Judicial Court of Massachusetts. Santa Fe Pacific Railroad Company, the exception, sustained the action of the trial court and thereafter pursuant to the verdict of the jury. He was sentenced by the court to pay a $5 fine, and the court ordered that he stand committed until the fine was paid. George Fred Williams and James A. Harlan, the plaintiff, in error. Arguments of counsel from page 14 to 18 intentionally omits Merzier, Frederick H. Nash, and Herbert Parker for defendant in error.
Talk about a dramatic day at the Capitol. Protesters lined the halls trying to stop a plan to crack down on medical vaccine exemptions. Protesters banged on the Senate doors, delaying the session by more than an hour, but the final vote went on.
Ayes 27, noes 11, the measure passes. Members, we are... Really?
You hear the reaction there in the hall. The bill passed the Senate just hours after it passed the Assembly and days after new changes were made. And a few minutes later, we found out Governor Gavin Newsom had already signed this bill and a second one to support the new plan. It all happened very fast. Becca Habegger is following the story for us tonight. And Becca, this is a controversial topic.
Yeah, vaccinations are a hot topic indeed among some groups with very strong opinions. But, let's put a pause on all the drama and just look at what became law today. Kids with an exemption issued before this coming January 1st can keep attending school until they hit the next milestone. That's either kindergarten or 7th grade. But starting in 2021, it's going to get a lot harder to get a vaccination exemption, and kids without them have to either get vaccinated or they can't attend school. As of 2021, all medical exemption requests must come through the state's California Immunization Registry. And the new law asks for a lot of information on that standardized form, including how long the doctor issuing the exemption has been treating the child and an explanation of of why the kids should be exempt for each specific required vaccine, and law lays out at least 10 of those. The form also requires a doctor to certify that the information she or he is providing is, quote, true, accurate, and complete, and the law says that providing false information could get that doctor in legal trouble. Also, the state will create a standardized system to track not only immunization levels in schools, but also which doctors are submitting unusually high numbers of exemption forms. So, many medical professionals say this will help keep kids safe and healthy, but the other side is personal for a lot of people, and we spoke with some of them today.
Seven-year-old Olivia and her parents came down from the Reading area today to protest at the Capitol.
We listened to a pediatrician that said it was in her best interest to have her vaccinated at 2 months, and she was vaccinated and she had a terrible reaction. We spent 3 weeks in ICU and we almost lost her. She ended up having a brain infection and a blood infection.
I asked if they were able to pinpoint exactly what caused that reaction.
We had a couple of specialists that did tell us that they had sort of felt that it was the vaccines and for us to not vaccinate. And so we've stuck to our guns and have not vaccinated since.
Dr. Dean Bloomberg is Chief of Pediatric Infectious Diseases for UC Davis Children's Hospital.
So vaccines are safe and vaccines are effective and vaccines save lives. There's no question among the mainstream medicine and scientists about that. Those are all proven facts. But there are those skeptics out there who don't believe that, who do believe that vaccines are not safe, and it can be very confusing for parents.
State senators discussing the bill before a vote today had this to say.
We shouldn't be vilifying parents that are only accused of wanting their children to be healthy. Why would any parent want to not immunize their children against a disease like measles that could kill their children, and with the overwhelming fear that they have that the cure could be worse than the disease itself?
Olivia's mom, Tricia, says she's not giving in.
As mothers, we rise up, we fight, and we won't give up.
Tembi is not her real name, and she doesn't want to show her face because she's afraid she'll get into trouble for complaining. Reading this newspaper article has made her angry because it could explain why her newborn baby died. At least 10 babies have died in the same hospital in Tembisa Township in Johannesburg in the past 2 months. The government blames drug-resistant bacteria.
I think it's more than that. It's more than 10 babies. The Tembisa Hospital is hiding information. Because if they're hiding information from us, like to what was happening with our babies, the only thing that we knew is that our babies are sick.
The cause of the infection isn't clear. Doctors say it can lead to pneumonia and meningitis. Some South Africans blame hospital overcrowding, understaffing and poor hygiene. Health department managers admit employing more nurses and doctors could help prevent more deaths, but there are other issues.
The problems that we're dealing with is issues relating to resistance to antibiotics. Because when we use antibiotics, we don't finish the course. We use antibiotics that are not prescribed or doctors prescribe antibiotics for any other reason. It leads to our bacteria not being able to respond to these antibiotics, which is a big problem.
Africa's most industrialized economy is struggling to provide affordable, quality healthcare for the majority who are poor. In some neighborhoods, private clinics try to ease the burden if patients can afford to pay to avoid the long queues. But there aren't enough private clinics to substitute overstretched and ill-equipped state-run hospitals. The government wants to introduce a national health insurance scheme to try and close the gap between the rich and the poor. At the moment, only a privileged few receive world-class care at private hospitals, while millions of mainly poor Black South Africans have to rely on understaffed and overcrowded public health facilities. The proposed insurance scheme bill still needs to be debated in Parliament. If it becomes law, the state will control how much private health facilities charge, making it more affordable for the poor. Tax rises will be needed to pay for the scheme, but some economists say the country's struggling economy can't afford it. The ruling African National Congress says universal health insurance is the solution, but the mothers who recently lost their babies say it's too late for them.
No, I don't see myself going back there. Ever.
Harun Mutasa, Al Jazeera.